Have you ever wondered why healthcare in America is so expensive? Why a simple ambulance ride can cost thousands of dollars? Why hospital bills can destroy someone's savings? And why millions of Americans still struggle to afford health insurance? The truth is, America has one of the most expensive healthcare systems in the world. And the reasons behind it are far more complicated than most people realize. Let's break it down simply. Health insurance in America works differently from many other countries. In countries with public healthcare systems, the government usually pays for a large part of medical costs through taxes. But in the United States, healthcare is mostly run by private companies. That means insurance companies, hospitals, pharmaceutical corporations, and medical businesses all operate to make profits. And when profit becomes the goal, prices go up a lot. Most Americans get health insurance through their jobs. Employers help pay part of the monthly insurance premium, while workers pay the rest. But even with insurance, many people still face huge medical bills. Why? Because insurance doesn't always cover everything. Americans often have to pay deductibles, co-pays, prescription costs, and out-of-network charges. For example, someone may pay hundreds of dollars every month for insurance, but still owe thousands more after surgery or emergency treatment. Now here's where things become even more shocking. Hospitals in America can charge almost any price they want. There is no universal price system. One hospital might charge $10,000 for a procedure, while another hospital charges $30,000 for the exact same treatment. Even basic medical items can become incredibly expensive. A single bandage may cost dozens of dollars. An overnight hospital stay can cost thousands. And prescription drug prices in America are among the highest in the world. Many pharmaceutical companies argue that high prices help fund research and innovation. But critics say large corporations are making massive profits while ordinary people struggle to afford medicine. Insulin is one famous example. For years, many Americans with diabetes paid extremely high prices for insulin, even though the medication has existed for decades. Now let's talk about insurance companies themselves. Insurance companies make money by collecting premiums from millions of people every month. But at the same time, they try to avoid paying more claims than necessary. That's why some treatments require approvals. Some medications get denied, and many Americans spend hours arguing with insurance providers over coverage. This creates frustration, stress, and confusion. Another reason healthcare is expensive is administrative cost. The American healthcare system is extremely complex. Hospitals need huge teams just to handle paperwork, billing, insurance claims, legal issues, and coding systems. All of this adds extra cost to the final medical bill. Then there's medical debt. Millions of Americans are currently in debt because of healthcare expenses. In fact, medical debt is one of the leading causes of financial hardship in the United States. Some people avoid going to the doctor simply because they fear the cost. Others delay important treatments because they cannot afford them. Imagine being worried about your health, but also being terrified of the bill that comes after. That's the reality for many families. And things become even harder for people without insurance. Without coverage, even a short hospital visit can cost thousands of dollars. An emergency surgery could lead to debt that takes years to repay. So, why doesn't America switch to a cheaper public healthcare system like some other countries? Well, that question has become one of the biggest political debates in the country. Some people believe private healthcare encourages innovation and better quality treatment. Others believe healthcare should be affordable for everyone, regardless of income. There are strong arguments on both sides. But one thing is certain: healthcare in America has become a massive business. Insurance companies, hospitals, pharmaceutical corporations, and healthcare providers generate billions of dollars every year. And ordinary people are often the ones paying the price. The healthcare industry in the United States is worth trillions of dollars. That means enormous financial interests are involved. Changing the system is not simple. But the conversation around healthcare costs continues to grow every year, especially as inflation, prescription costs, and insurance premiums keep rising. For many Americans, health insurance is no longer just about protection. It's about survival. And until the system changes, millions of people will continue asking the same question. Why is healthcare in America so expensive?